Because I want to speak to Azeem Majeed. He is a professor. He's a professor of primary care and public health at Imperial College, which is a very important title to have, a man of much knowledge here. Professor, the thing is, for me, I'm a bit worried about sitting on a plane with people who could be full of germs or full of COVID and passing it on to me. It sort of seems that, you know, without that test of getting on the plane, is that not leaving us more exposed?
It does leave us a bit more exposed, as you mentioned, Damon. If you're on a plane or an airport, if people have not been tested, some of those people may be unvaccinated, may be infected, and could infect others. So there is a slight increase in risk for people in airports and on planes from scrapping PCR tests before travel.
Yeah, slight increase, you say?
I think a slight increase. The evidence shows that on planes, because of their filtration systems and ventilation, that does tend to reduce the risk. So the risk probably is more in the airport itself, so rather than on the plane, because the planes generally have good ventilation and filtration, which tends to.
So basically, what you're saying, I mean, the travel industry, they have been begging for a relaxation of rules. This has to be good news for them, with a minimal increase of risk to the rest of us.
That's right. So these kind of measures work best when infection rates are low in the UK. We've got now very high rates in the UK. So testing people coming into the UK won't have much effect on our own infection numbers. So I think this is good news for the travel sector, which has suffered very badly over the past 2 years. And now we've got such high rates in the UK. Testing travellers coming here isn't going to be so effective in stopping our rates going up.
Professor Majeed, I just want to ask your opinion on whether or not you think we could be back to normal in 3 weeks. This is what's being put on the headline of the Daily Mail. It's the Prime Minister being very optimistic. But given the state of our hospitals at the moment and the fact that we're seeing admissions doubling every 9 days, do you think that's realistic?
I think that's very unlikely. I think we'll see people carrying on with wearing face masks, working from home, and other measures like testing going on for some time to come. We also need to push our vaccination program as well more. That's worked very well in keeping down the number of serious cases and deaths. And it's essential we keep on, boosting people, getting people to come forward if they've not been vaccinated. But I think the Prime Minister is being, too optimistic in thinking we can end these measures in around 3 weeks' time. I think it'll carry on for some time to come, perhaps even, into March, possibly, depending on the case numbers in the UK.